Finally! Just a little more and I will complete the task. Oh no, please! Not now! Oh no! During any crisis situation, such as war, natural disasters, or any situation where people may have to leave their homes, remain without shelter or move to camps, they may face various risks, like experiencing some form of violence, separation from family, lack of access to medical services, sudden loss of resources, or not being able to go to school. Some people are especially vulnerable during crisis situations, including girls, young people with disabilities, LGBTQ youth, and young people living with HIV. Even in such crisis situations, you have the right to be safe and access health services, clean water, menstrual hygiene products, and other sanitary and hygienic items. Access to condoms and contraceptions are part of something called Minimum Initial Service Package for Sexual and Reproductive Health in crisis situations. These services should be available to help you stay healthy and prevent unintended pregnancy and sexually transmitted infections, STIs. It is natural if you are feeling scared or confused about how to take care of your sexual and reproductive health during a crisis or want to share your feelings. There is nothing to be ashamed of, and it is important that you talk to a trusted adult or your local sexual and reproductive health organization. In crisis situations, there is often a risk of being exploited or abused, so it is important to know your surroundings. Pay attention to how people communicate with you, and if you think you are in any danger, most likely you are, and it is better if you talk about it with an adult you trust. Sexually active young people in crisis settings may particularly be at risk of unwanted pregnancies, sexually transmitted infections, and violence. It is important to access condoms, contraceptives, and help if you need it. All young people have the right to sexual health services and support, including those from the LGBTQ, indigenous and migrant communities, those living with HIV, heads of households, widowed, sex workers, and former child soldiers. It's not easy to be in a crisis situation, but many people are. Being aware of resources like a national hotline that you can call, agencies that provide support, health services that are available to you, and who you can talk to can be helpful so that you can take care of yourself even if away from home.